Good afternoon, Sherry.
Hi.
Hi, I'm Dr. Tutak. How are you today?
Pretty good.
Pretty good. Well, we're here to discuss the X-ray findings and why you've chosen this office.
All right.
I'd like to start out for the audience here to introduce myself as Dr. Tutak. Sherry, I did 4 years pre-med at Wayne State University in Michigan. Then I went on to the 5 years chiropractic in Los Angeles College of Chiropractic, which I finished in 3 1/3. Then I went an additional 3 years up in Portland, Oregon, and specialized in chiropractic orthopedics. I'm also a qualified medical examiner for the state of California. I'd like to start out by explaining to you the techniques that we utilize in this office. The primary technique we use is called chiropractic biophysics. Essentially what that means is we take a look at your spine and we determine the weak points of your spine, and then through muscle rehabilitation, re-education, and through neuromuscular education, we build back your spine to its optimum level that we can achieve. Essentially, what I'd like to do is show you before we go on to your x-rays an example of this.
All right.
If you think of your head as a 25-pound bowling ball, kind of suspended there in space, essentially we've all seen people walk around like this, and then like this, then eventually they end up like this. God wants us like this, like a fulcrum. This is a 38-year-old female who came into our office 2 years after a motor vehicle accident. The primary curve of where she's supposed to be, or the cervical lordosis, is here. This is where she is now. This has caused premature degeneration of her vertebral disc, which means there were excess pressure being placed on her disc on these, what we call vertebral motor units, and also along what we call the articulating surfaces, or where the vertebrae actually move.
Okay.
This is after 8 months of therapy. Through our techniques utilized at this office, we have literally started reversing some of the arthritic changes on those articulating facets.
Wonderful.
And we have gotten her cervical curve back in line to set her up for optimum health and disbursement of pressure throughout her spine. If we take a look at your examination now, Sherry, we will see that you have what we call a congenital scoliosis. This has caused an accentuated lateral shifting of your spine. Through the type of techniques that we practice here, our goal will not always be total correction because of your age and the amount of degenerative changes throughout the spine. However, we will try to stabilize the musculoskeletal system, and at this point decrease the amount of pain and increase the range of motion and increase the muscle strengthening and integrity of your spine. Do you have any questions, Sherry?
Yeah, I'm just curious, like, what techniques and stuff will you use to?
We will use a drop table technique, which is specially designed for chiropractic biophysics. We will use muscle-skeletal wedging and exercising, and we will also utilize home exercising and stretching for your spine.
Oh, okay.
And we also have techniques here of electromuscle stimulation, such as interferential and ultrasound therapy, that will work along with strengthening the spinal integrity of the muscular components.
Interesting. Thank you.